Hey guys, what is up? My name is Sophia and I am a third semester nursing student. I have one final left and then I have a break for 2 weeks and then my fourth semester and then I am done. I'm graduating. I graduate in early August and I'm super excited for that. I am in an accelerated program, so I think the semesters are a little different. But anyways, I wanted to make this video and talk to you guys about my practicum placement and just how everything went down. So I made a previous video and I just kind of talked about the form, but just to like summarize it a little, get a form. It's called like a practicum preference form. So it's just what we prefer to have, so it goes by ranking. So you rank them, but it's 4. So it's the unit that you prefer to work at, the time, so if you want like what shift you want, like the day or you want the night, and then the location, and then the hospital. And then our clinical coordinator coordinates with hospitals units to suit us, and obviously she has to coordinate with the preceptors as well. But she did a great job, and yeah, I can't even imagine how much work that is, but I should not even just thinking about that, whatever. Anyways, so I ranked that. I kind of really didn't care. All I just really cared about was the unit, and that was emergency room. I was so set on the emergency room, and when I think back, I'm like, why was I so set on that position or that unit? Like, to be real with you guys, I've never been in the emergency room. Like, I've only been in triage for OB, but like never the emergency room. And I was just like talking to some people. Some was like when she went to observe there, because I was just like, oh my god, what if I don't get this position, whatever. And then she was just like, it's not like all like crazy all the time, you're gonna get a lot of like people who may be drug seeking, who may have like abdominal pain, who may just like have a blister, so it's not all just like and I literally don't know. I do watch a lot of videos on YouTube of ER nurses and just their day-to-day life, and I always found them really interesting. But like I said, I've never really been on the unit before, so I really have no idea, but I was just so set on it. I like the idea of getting them, like stabilizing them and getting them out. I think that's just super cool. But I don't know, then I just talked to someone else, and she kind of said the same thing too, and I was like, wow, like you're right. And one thing, like obviously you can listen to what people have to say and their advice, but when it comes down, like don't let anyone like change what you want to do, and that just goes with literally everything, not just nursing. But anyways, but you know what, I changed. So but I'm really happy that I did. So I got ICU. I don't know if I said that already, but going back to the preference form, I sent that in to her, and I think it was like 3 weeks ago I sent that into her, and then we just got our calls yesterday. And one thing to like, I guess not stress about, but it's just when you're in school, how they go down the line of like who gets like first choice on certain units is by your GPA. My GPA right now is a 3.5, so I obviously was not the first person that my clinical coordinator called, but whatever, I'm happy what I got. But yeah, so she just had one day yesterday where she called the whole cohort, and then depending on like what units and what positions that she had, she would let us know, and she would just like briefly like give us a little summary like on email on what is left. So that's really, I don't know, that's like very exciting time, because as nursing students, like when you're in your freshman year, like this is something that like you look forward to doing. It's your 4th semester, you're in that unit that you want to work in, you have more autonomy. Like with clinical, like you're with a group of people and you have one instructor, and then you're either assigned like a nurse or you're assigned a patient, and it goes from there. But you also like, if you ever feel uncomfortable, you have like your people to go to, and you just always have like other classmates to just like hang on to, if anything. But 4th semester, like you got to get out of that. So it's just you and a preceptor, and it's I think it's 14 shifts. So yeah, it's not like you have your buddies with you now, it's just you and you're on your own. And I thought that's really cool, because it's that one-on-one. And yeah, I learned so much throughout this program and being in clinical. But I think I know when I have my preceptor and I'm literally like, this is like her job to just focus on me, and obviously for patient too, I'm gonna be able to learn a lot. I'm gonna be able to pass meds like every shift with her. And yeah, that's not like in clinical, like you don't do that. Like you probably do it like 1 or 2 times with your instructor, but this is like constantly, and your preceptor is like, and obviously the patients are their responsibility. The preceptor is the preceptor's responsibility is me and also the patient. So I think that is really interesting. I really hope I have a preceptor that I mesh with. Just in life, you're not really gonna mesh with everyone. So I really hope that we have like a very like equal professional relationship, and we both like learn from each other. And yeah, I just hope I really learn a lot, and I'm really excited. I'm going into this positive, I guess. But yeah, so I don't know if I said it, but it's 14 shifts, it's 168 hours. One thing that's different than clinical is with clinical, you already have your set time and your set day when you're going to go to that unit. But with what's it called, your practicum, you get to choose. So you get to see what your preceptor, her schedule is for like when she works, and then you go by when you want to work. But it obviously has to be within a range. It has to be within the 4th semester. So I can basically knock off all my my shifts in the beginning of the semester, compared to spreading them out. But I think I'm going to spread them out, but honestly, who knows? One thing, it's overnight. It is overnight, and I was like, yeah, like overnight, like okay. But I don't really think that was an educational answer, I guess, or educated answer, just because I'm still in school, I still have class, I still have another clinical, my public health clinical, and then I'm going to be working overnight. So that's something that I should have maybe thought of more, but I'm just going to like deal with it, and just deal with it in a couple weeks when I have that issue. But I'll be fine. But yeah, so I think that's really cool how you're able to decide when you want to choose your shift. And also the instructor in clinical, she is not a nurse on the unit right now. She's just in charge of you. And then our preceptor, she's in charge, she's working as a nurse during that shift and also in charge of me. So I think it's really cool. So I'm going to go over some of the, the units that were available. So we have PICU, which is pediatrics ICU. We have ortho, neuro, peds, triage. We have antepartum, gyne, L&D, NICU, and mother baby. And majority of people in nursing school are females, so a lot of the peds and the mother baby were gone. And I know NICU was a very, very, very popular choice for a lot of people, and they only accepted 2 students. So yeah. Okay, so there is emergency room, rehab, cardiac PCU, neuro PCU, oncology, which is cancer patients, ortho spine, surgical PCU, and PCU, so it's ICU, and then it's step down, and then it's PCU. There's med surg, there's vascular surgical step down, there's neuro step down, and that's what I did for my previous clinical. There's ICC. Oh, I literally searched it up yesterday, intensive critical care. I think I'm wrong, whatever, intensive. At first I searched it up and I put like ICC medical abbreviation, and I got like intra, what did I get? I forgot what I got, to be honest. Let me search it up right now because that was kind of funny. I'm like, what unit is this? And see. Oh yeah. Oh, now it wants to tell me it. Oh, it was intercostal catheter. So I'm like, okay, that's not a unit, but it's integrated comprehensive care, I guess. No, that's not what it is. All right. Now I really gotta find it. I think it's intensive critical care. I don't know. Or intensive cardiac care. Let's see. Unit. What is ICC unit? Intensive cardiovascular care. I really have no idea. All right, let's just ignore that. Intensive coronary care. Okay, let's just go with that. All right, so let's see. Medical ICU. Oh, so there's ICC, neuro ICU, medical ICU, and psych. And then there's another hospital that's L&D, mother baby. Mother baby is just like basically after you have the baby, so postpartum. Peds, heme and oncology, peds epilepsy. I don't know what that unit is, to be honest. Like, I don't know if that's like outpatient, so I was kind of like confused on that, but I didn't really want to do peds anyways. Psych medical unit, MSICU, and that is multi-system ICU. I was talking to someone yesterday, and she thought it was medical surgical ICU. So yeah, it's multi-system ICU though. But you know, who knows? Like, you know, I would have thought it would have been like musculoskeletal ICU. You know, I have no idea. CV ICU, and that is cardiovascular ICU. And then there's cardiac ICU. So it's like, what's the difference, you know? So I think with CV ICU, those are more procedures. So people who just came from OR, maybe who just came from the OR, so maybe they had an open heart surgery or just had like a coronary bypass graft, just different procedures like that. Yeah, so usually like after you get from the OR, you go to the PACU, but this is straight back to the ICU. Let me see. Okay, so then there's vascular thoracic ICU. There's cardiac ICU. So I guess that's just patients who have like cardiac issues. So yeah, cardiac PCU, BMTU. That is bone marrow transplant unit. And then another ED. And then another hospital is ICU, ED, and OB. And the other one is med surg, heme, and oncology. So those are just some of the units, also with the different hospitals. Yeah, so I was gonna go for ED, but I went with multi-system ICU. And I'm really happy with my choice. I first was like, ooh, like I wanna do cardiac, you know, but that was filled when I had my turn. And then I was like, oh, should I do CV ICU? And I really had no idea. And I was talking to my clinical coordinator, and she only has 5 minutes to talk to us. And she was just telling me about it and stuff. And then she was like, well, is this something that you want to do in the future? Like specialize in cardiac? Do you know a lot about cardiac procedures? And I was like, you know, like not really, I guess. She's like, yeah, because like you don't want to like go into something and just not know like these procedures, and then you're like here like in the back on your phone trying to search up the procedure. And I was like, yeah, you're right, because I totally understand, especially in first semester when like you are in clinical or you're doing something like hands-on or something, and you're like or in lab, I would say, I'm just doing it, but it's like you're not able to like critically think and just like, okay, this is why this is happening, because you don't know. So I was like, yeah, you're right. And I don't know if I do want to specialize in cardiac. I have no idea. I do find cardiac very, very interesting, but I don't know yet. And I think since I'm still in school, might as well do multi-system so I can get literally all the systems, and I think I can just learn a lot from that. And I didn't know if it was like, if this multi-system was still the ICU. I was like, are these patients critical? Like how is it? And she's like, yeah, these patients are critical, it's ICU. And I was like, true, like okay. So I think that I'm honestly really happy with my decision, and I'm really happy that I changed my decision, to be honest. ICU, you know, intensive care unit, these patients are very, very sick. And when I was in neuro step down, these patients were also pretty sick, and there was family members there, and I just very much enjoyed taking care of them, just speaking to them. Just, they're vulnerable. These patients are very vulnerable. These family members are like helpless and literally relying on the providers and other professionals to care for them, and that's just very rewarding. And it's nice to develop relationships with your patients. Yeah, and just to be in like, I don't know how to explain this, but it's like I am capable. I'm healthy, mentally healthy, just all around. That I'm capable of learning, and there is a lot of people who are not capable of being in this position, as in maybe someone who has like a mental illness, and it just goes on from there. But I'm capable of being an ICU nurse, so I want to take advantage of that. I know after grad school, I probably will not go into that just because I want to gain that experience and I want to be somewhat confident in my knowledge to put myself in a position like that. But just getting into that role and seeing how it is, seeing how sick these patients are and learning how to speak to the family members, especially when like they pass away. So I think all in all, I will learn so much. My fourth semester, it was, what's it called? Okay, so I have adult 1 and adult 2. So second semester I had so first semester I had pathophysiology, and then semester 2 I had adult 1, and that's more focused on chronic care. And then adult 2, which I'm in now, and I have my final Monday, which I'll be totally studying for, that is more on acute care. And then fourth semester is intensive care. So I'm very, very excited for that lectures, because I will totally learn a lot, especially if I do see myself being an ICU nurse in the future. So although I'm still a student, I don't know a lot, especially when it comes to certain drips, certain like monitors, medications, just the protocols for ICU. I want to have some like knowledge in the back of my mind where I'm able to just like put 2 and 2 together in a way. Obviously, what I'm learning now pertains to the diagnoses. The diagnoses that I am learning now are going to like these patients are going to basically have in the ICU. So yeah, but anyway, so I emailed my professor. He was my adult 2 professor for acute care, and he's also my professor for intensive care next semester. And I just asked him, I'll literally read you what I wrote. So I was like, hello, doctor. I hope you're doing well. I will be doing my practicum in the multi-system ICU. Is there anything specific that you think I should focus on during the break to help me prepare? What do you think would be some of the common diagnoses? And then I was like, I don't know if my question made sense. Usually when I email professors, I have to like read it like 20, 100 times just because I'm like, let me hopefully don't miss a period or misspell a word, because that's not good, But I was like, I know cardiac and neuro have specific ICUs. Would it be uncommon to have cardiac neuro patients in the multi-system ICU? Like, obviously, like, organs fail, so I know in the multi-system, I will have patients who have a cardiac issue. But then there's also a cardiac floor just pertaining to cardiac ICU. So I was just like, do we get a lot of cardiac patients? But I didn't really know how to say that in an email, and he totally did not even, he didn't answer that question, which is fine. Shouldn't even said it, whatever. I think I just like, if I were to assume, I would assume that I will be getting cardiac patients, but I think their focused issue is maybe on a different organ, I guess. I have no idea. But when you're in the ICU, you're going to have organ system failure. So yeah, and like I said, a lot of people pass away in the ICU, so I guess they're all gonna have those issues. So what a stupid question that I just asked, whatever. So he's like, hi, Sophia, okay. He just talked about the hospital, okay. So multi-system, so he actually works, I thought it was really cool. He works 2 shifts a month, one weekend. He works 2 shifts a month on the weekend, whatever. So he's like, multi-system ICUs are usually medically focused as opposed to surgical. You'll see a lot of sepsis, ARDS, pneumonia, GI bleeds, DKA, cardiac arrest, and mental status changes. And then in parentheses, he just put decompensated liver failure, electrolyte abnormalities, uremia, drug overdoses, and alcohol withdrawal. And then he just said, if you're at this specific hospital, you'll have some trauma overflow, because that hospital, they have a trauma ICU. And then if I'm at the hospital that I'm going at, I'll have liver transplant patients or cases. I'd spend some time reviewing the respiratory, GI, hematology, fluid, and electrolyte and renal lectures, which is basically everything. And then he said, I think you'll find next semester shock, respiratory failure, ventilator, sedation, neuromuscular blockers, cardiac arrest, rapid response lectures very helpful. And then he's so nice, like he really don't have to do all that. And I was like, doctor, I was gonna say the name. I was like, how am I practicing at this hospital? And I'm like, I appreciate your time. I look forward to your lectures next semester. And then he was like, so I thought he was just gonna like stop answering from there. And he's like, that's a great unit. We have many former students there, and 2 to 3 traditional students will be working there after they pass their NCLEX. I'm sure they will make sure you have a great experience. Adjunct instructor blank also works on my unit, and she's a terrific nurse. I hope you enjoy it. There's some people, some professors just like, I guess do the bare minimum or just do what they are supposed to do. But like professors like this who like go out of their way and just like respond back to you and like really put thought into like what they have to say and effort and time, like I really, really appreciate that a lot. So I really appreciate this professor like so much. Anytime I have a question about like a test or just about anything, like he'll literally send me like a story back. So I really appreciate that. Anyways, so yeah, multi-system ICU. I'm super excited. I have 2 weeks off until I go into my 4th semester. So during that time, I am going to be for sure looking over things. So I am prepared. Yeah, so wish me luck, guys. Maybe to tell you guys how I am going to prepare. I don't know if I'm going to look at my lectures, to be honest. I'm scarred from them. I need a break from them, but I will for sure be on YouTube, and obviously depending on the channel, but majority of the channels that I follow are very, I guess, trustworthy. I trust what they have to say. They are different nurses and providers and just other health professionals that I watch. And I learned so much from them. For a long time, I was just doing ER and just seeing how they do and like learning about like different like common diagnoses in ER or like their day-to-day life or some common medications there. So that was beneficial for me. So now I'm going to just switch that over to ICU and just focus on ICU only. Just seeing how like people's day-to-day life as an ICU nurse, just some tips, anything like that. But I know I've been talking forever, so I guess you can just like turn it off if you really don't care. But I do want to just, let me go to my watch later. All right, let me just like turn it off. Watch later. So what I do is I like obviously when you're on YouTube and you watch like the same thing, they're going to recommend like that specific topic to you. So I just put everything in watch later that I just go by after the next video is done, and I just do 2x speed and I'm able to like I guess listen to that. So I'm definitely gonna look over electrolytes. I don't know where they are. I have to delete a lot of the ER videos that I watched. Let's go to date added newest. But I've learned so much just from watching someone's day-to-day life, especially just like hearing about a procedure. I'm like, oh wait, I learned about that. So you kind of can put 2 and 2 together. But yeah, so videos like, what is it like to be an ICU nurse? Week in the life of an ICU nurse extern. An extern is after you graduate. And I think it's after you pass your NCLEX too. I don't know, don't quote me on it. So someone's like, why I chose ICU. And then there's this channel that I found. It's called ICU Advantage. I'm gonna click it and show you guys. Okay, so it'll just tell you about airway management. It'll tell you about like how to read a CT scan. It'll talk to you guys about different like common diagnoses in the ICU. So let's say like, okay, so I'm just gonna read some of the videos that they have. So they have the basics of chest tube management. What is a pleural effusion? What is a hemothorax? What is a pneumothorax? Mechanics of breathing, all about central lines, arterial lines. So I've heard about these things, but literally just heard. It wasn't like extensive learning about it. I think that's more of next semester. But anyways, I might as well just like get into it. And you know, you want to be prepared when you what's it called? When you are first off in clinical and also when you are in practicum, because like when you are in practicum and when you're in clinical, like this can be where you want to work. There are nurses watching you, seeing like if you would be a good fit for them. But you definitely have to do some homework on your own if you decide to when you get into specific units. Just like with neuro, I didn't do any homework before, and I just felt really stupid the day I left. So then that day I went on YouTube and I learned how to do a handoff report, which seems easy, but I didn't know how to do it. And then also how to do a focused neuro exam. Didn't really know that either. So, but obviously since I'm on a neuro floor, I should probably know that, you know? So I can talk forever. I don't know if I missed anything. 14 shifts, 168 hours. We're able to pick what shifts you want to work. I have night shift. And when it comes to my preceptor, I haven't met her yet. I think we meet here like the first week of the 4th semester. Yeah, so I think that's kind of it. I don't want to forget anything. I know I've been talking forever. Yeah. Also, there's some people who didn't get what they wanted, you know, but when it comes down, like, it's only for 14 shifts, like, it's only 14 shifts, and I would just make the most of whatever unit that you get. But I guess it's hard to say because I did get a unit that I wanted, so I guess it's easier said than done. But I think regardless where you are going to learn. But one thing, I would definitely, like, focus on what you want to do. So if you are interested in pediatrics, I would not do adult. I would focus on your certain population because yeah. But I think that's it. Yeah, I don't know. 28 minutes. I'm gonna speed this up a little. I just don't know if I forgot anything. But yeah, that's pretty much it. Literally, it's pretty much it. If you want to, like, I guess learn more of what I said, I would look at my other preference form. But yeah, so that was my practicum placement, multi-system ICU. Yeah, I think that will be very helpful for me. And then, yeah, so that's it. I really need to study, and I don't want to study. I don't want to study, and I need to. I'm really behind. But let me do that right now. All right, guys, thank you for watching. If you are in your first semester, if you're in your first semester, or if you're watching this and you're not even in school, like you're like studying for your T's or you're thinking about nursing school, it goes by so fast. Like, I know everyone says that, and I used to always be like, you know, roll your eyes, be like, yeah, okay, you know, especially like in high school, they're like, oh, it's gonna go by so fast, and you're like, yeah, it goes by so fast. Like I have one more final left of my 3rd semester, and then I'm in my 4th semester, and then I graduate in August. It will literally be here before you know it, and yeah, whatever semester you're in, just always make sure that you know that you are learning. Because like I said, I think I've stressed enough about it just personally, and I think I have in a video that like you're learning, and you're not going to know everything. Even there's new grads or even grads who don't know everything. You are going to be learning every day, but it does not feel good. Well, I don't feel good sometimes when I am in the unit and I'm a student, and I feel like a waste of space, to be honest. Like I just feel like I don't know a lot, you know, and you're learning, you know, so always remember that you are learning, and just remember that, and just always try to improve whatever you're doing, you know. But yeah, guys, we will all get there. Try not to compare yourself to like other people, even though I do it all the time. Yeah, I'm great at giving advice, but can I take it? I gotta work on that. But all right, guys, let me know if you have any questions or you want to say anything down below. I will be more than happy to answer. Honestly, I get so happy when you guys comment. Obviously, hopefully it's nice. But all right, guys, thank you guys for watching.